Okay, so in this video we're going to go through an ITB MET technique. So it's a technique you can use for someone who's potentially got a positive Overs test. So Glenn, what we do for this?
We're actually starting that Overs position. So we've gone through that in a separate video, so I'm going to just briefly talk through it. I'm going to take Patrick's leg out into abduction. I'm going to make sure that he's not rotated backwards at his pelvis. I'm going to have my left hand stationary over his iliac crest. Just let your leg go heavy for me, Patrick. Let me take the whole weight. Notice I've got my hand under his knee. I'm taking the weight of his leg, and I'm just going to slowly lower until there. Now I feel a bit of pressure against my left hand. I feel like his pelvis wants to push into my hand as his ITB tightens up there. So what I'm going to do now, I'm going to bring my body over his leg. Patrick, just push up into me. That's it. I don't full power, just about 60% of your power. Hold that, hold that. I'm going to do about 9 to 10 seconds. And relax, and then you pause, let your leg go heavy again. It's important to let that pause 1 or 2 seconds between the activation, and then I'm going to lower again. And now I feel a bit more resistance. Same thing, push up against me. And relax, nice deep breath. Let your leg go completely heavy, that's it. Okay, and we get a nice release there. So I usually do 3 to 4 of those METs in one treatment session. And I think it's a nice preliminary treatment to open up into soft tissue treatments, or taping techniques, things like that as well. The client can get a real good feedback by actually feeling that muscle releasing and feeling that mobility improve as well. And it links in with your Overs test, which is your objective marker that you can use for them in future treatments.
Yeah, and I think one thing you said there, which again with the MET stuff I really like, is the breathing out. So deep breath in, deep breath out. I think on that deep breath in, deep breath out, you're giving it a second to get that reciprocal relaxation of the tissue, but the second thing is that you're on the breath out, you're getting a relaxation through that breath, so it just naturally allows it to come into that position. And I do that with patients all the time with the MET stuff. Is pretty much every time actually I'll say breath in, breath out, deep breath in, deep breath out, every rep or every time I've done the MET, and then go down into that position. I think it really helps.
Yeah, I think in the past I've fallen into the trap of trying to get the resistance and then go straight down into movement, and there's still that residual tone, isn't there?
Yeah.
And you do just get such a better effect when they're active in the treatment and you know, actively releasing the muscle themselves.
Absolutely, yeah.